Okay, so here we have the MEDI TAC Hawk type rip-away, I wouldn't say IFAC, but first aid kit. So starting off on the front, simple MEDI TAC pack here, the rubber top and hook and loop Velcro on the back. It's all Velcro, so you can put any patches you want, like a American flag patch, Texas flag patch, first aid patch, even patch. If you have identifier patches, you can use that as well. It has this little buckle here, which attaches to the back, which is this rip-away panel. And because it's not attached to anything, that was a little harder to come off, but you can attach this using the hook and loop or the giant straps there, and you can attach it to pretty much anything, a headrest, another bag, pretty much anything, and then you can attach the pack to this itself. And over here we have a carry strap, so you can carry the pack itself if you don't want to have it connected to something. And then we have another carrying handle here, as well as this little flap here, which really doesn't serve a purpose. It's just to hold the zippers down, and I guess just another tab to open to get to the kit itself. Zippers are pretty durable. They don't claim to be waterproof, but the kit itself is water resistant, so I guess that's kind of why they have this. Definitely wouldn't recommend submerging the kit, but if it rains while you have it on the backpack or something, that'll be perfectly okay. So we open this here, make sure everything doesn't fall out. We're going to start off with this side and then kind of go over here to the other section of it. Starting off, we have a softy tourniquet. Yes, it is open. I did open it and use it for something prior to recording this video, and I did take some stuff out, but I tried to put it back in to the spots that it came in, so that the places that they are as realistic as possible. Softy tourniquet, metal windlass. It has this clip here and then a triangle piece that goes on top to lock it in after it's put on your arm. As well as for taking it off, it has a clip here, so you can easily take this off, readjust this, and do whatever you need to do. It does also come with instructions and information for the softy tourniquet. I would recommend, if you do carry a tourniquet, to know how to use it, as well as to take it out of the plastic, because trying to open that in a trauma scenario is not the best of things. Next we have a adult and infant CPR respirator mask from Ready First Aid, and this is for doing mouth-to-mouth rescue breaths, resuscitation, mainly created for overdoses and other things where you're trying to make sure that you don't get contaminated with anything that the person may have. So it has a pair of gloves in here, an alcohol prep pad, then instructions for use. Oh, that almost fell. And instructions on how to use it, different things that it comes with. Different ways to use it, how to use it for infant and adult methods. Again, if you carry this, I would recommend knowing how to use it. It does say single use only, but you can, if necessary, you can clean it and use it again. So if we open the package here, we have the filter itself. You're going to breathe in from this side, and this side connects to your mask here. This part would go around the patient's head. Want to get a good seal with this cushion here, and then you would plug this little filter in here, breathe in, and hopefully that air will be getting to the person. And then it also comes with the infant version. The only difference between the two, obviously one is smaller, as well as this here is not hard plastic. This is like a rubber, and the air cushion is rubber. With the infant, the top part is hard plastic and the rest is, the air cushion is rubber. And then the infant also comes with a different filter to put on the mask itself. And that comes neatly in a bag, so you can carry it on your person, on the exterior of the kit. You often see these in the little fanny packs that in the fanny packs that lifeguards use. They often carry these in there, and everything just, well, there we go. Everything should just tuck right back into there. Put that up and put it back over here. Up here we have 4 bottles of, looks to be, yes, normal saline, just water, salt water basically. Got 4 big bottles of it. They are each 30 milliliters, and these are often known as eye flushes. You can also use them to flush out wounds. It's just to sterilize the eye, or sorry, not sterilize the eye, to get anything out of the eye if there is any foreign object that has actually gotten into the eye, and then any wounds, you can use it to flush those out as well. Moving on into this pocket, there's nothing really here. In the other pocket, we have this bag here, which I should get, there we go. In this bag here, there's a number of different things. You have two KN95 masks there. Then you have 1, 2, 3, 4, 5, 6, 7, 8 3x3 sterile gauze pads, as well as 1, 2, 3, 4, 5, 6, 7 4x4x2 sterile gauze pads as well. All that comes in that little bag there. We have not 1, but 2 instant ice packs here. We have Celix, I believe is how you pronounce it, gauze, Z-fold hemostatic gauze. It's basically the same as Quick Clot and Combat Gauze, just a different brand. For those of you who don't know what hemostatic is, it is a agent that goes on medical supplies, and it helps clot the blood, so that if you put it on the wound, it helps to stop that bleeding better. And then we do have Quick Clot. It's another thing of Quick Clot. It is a small little piece of gauze. This one is not hemostatic though. It's just a normal piece of glass. Further in here we have, I think that's it for that pouch, we have two vented chest seals. These are occlusive dressings for open chest wounds. They are mainly used in gunshot wounds. Each of them contains one chest seal, so it's meant for entrance wound, exit wound. I do like that they have a tear on either side, so no matter what side you get it from, you can tear that open. These are vented. They do sell some that are not vented. The reason I would recommend vented chest seals is that with an open chest wound, you're going to have blood coming out of that wound, and without a vented chest seal, you can cause blood to get clogged up there, and it can affect other parts of the bodies like lungs and just get trapped in that area. So you want to have a vented chest seal, which allows that blood to exit while still keeping that wound clear. And if you don't have a vented chest seal, it's very easy to burp a chest seal. You just, if you see that it's building up, which is called I'm probably going to mispronounce this, but hypopneumothorax, and when you see that blood collecting there underneath that chest seal, most of them are clear so you can see it. Another sign is that the chest will start to rise, or you'll see an expansion, what looks to be swelling in that area, and you can just burp the chest seal and allow that blood to come out, and then push it back down. And that's pretty much it for chest seals. Here. In the next pocket we have, and yes, most of this stuff is done through EverReady First Aid. I'm not sure if MEDI is owned by EverReady or if that's just one of their partners that they collaborated for most of their kits. They do have some other companies' kits, like I believe they have their S-rolled gauze is NRA. Sorry, not NRA, NAR, North American Rescue, but most of it in here is going to be EverReady. So we have a EverReady pair of stainless steel, or sorry, titanium trauma shears here, 7 by 1/4 bent tactical stealth trauma shears, and these aren't bad. The only thing is they're probably going to be good for 1 or 2 uses, and then they are going to either need to be sharpened or replaced. I carry the X shear in my kits, and I've heard from multiple people, including Sam from Prep Medic, that they have had them for a while and never had to sharpen them. And they're just not sitting in a first aid kit, they're constantly being used. So definitely worth investing in, but if you are a civilian that's not going to be using these every day, these are perfect. You're only going to need to use them once or twice, and then you can throw them away, and if you keep the kit, you can just replace them. You have a 2-pack of EverReady medical pen lights for checking pupil dilation. This is how they come. They come in this big bag and then the pen itself is in a small bag. With them, these separately packaged batteries. They do take 2 AAA batteries. Nice that they actually include batteries. Most things don't. And this one I have taken the time to pre-assemble. So you shine that at somebody's eye, and not at the eye, you shine it next to the eye and have them look straight forward, and you can check the pupil dilation using this gauge or this gauge. And they do open from either side, so you can open it from right here, or open it from And then of course they have the little clip so you can attach it on the outside. Inside another pack, you can clip it right here. You can do many things depending on how you reconfigure this this kit. One thing before we go on to the rest of the kit, I would like to see the trauma stuff more readily accessible, like the hemostatic gauze. The tourniquet was pretty accessible, but the hemostatic gauze, the other stuff that's over here, and some stuff that I'm about to show you. I just think that could use a little better organization. In here we have a padded aluminum splint from Ever Ready First Aid. 24 inches. You can use this to splint an ankle, leg, arm, knee, really any limb fracture that you can think of. You can use this to stabilize it. It does only come with one though. And here we have we have 2 liquid skin. Liquid skin tubes. These are basically just a bandage, a liquid bandage, so you put it on the wound and it is supposed to harden and be able to keep infection out of that wound without having to have a band-aid. In here we have 2 glow sticks, safety light sticks, chem lights, whatever you want to call it. Green, you just shake them, or crack them, shake them, and they're ready to go. Good for marking an injured person, flagging somebody down, or just if there's an emergency at night and you don't have a flashlight, you can use it to see what's going on, and they do come with 2. Now another thing that I like about this kit is that they have nasogeniopharynx airways. So what a nasogeniopharynx airway is it's this tube, and it is inserted into the nostril in any area or any emergency in which the airway is blocked, or they're doing CPR, or if it is a high level of trauma and there's a possibility of your airway being blocked, they will insert an NPA. It's mainly used in combat rather than an OPA, oral geopharynx airway, because OPAs, you have to deal with the clenching of the teeth, you have to deal with the gag reflex, you have to deal with the patient. If the patient is conscious, them having to deal with that, and if they're not conscious, waking back up with that OPA in their mouth. They do have the risk of biting down on that or choking on it when they do come back into consciousness. However, with the nasogeniopharynx airway, you can put it in. There have been many demonstrations on people who are alive, well, and active and conscious, and they are perfectly fine with that being inserted and taken back out. Now, some come pre-lubricated. This is not pre-lubricated, so you do have a little pouch of lubrication there as well. I would recommend taping the lubrication to the geopharynx airway, just so that you're not trying to find a little packet of lubrication while you're needing to put this in. I also would like to see, it comes with 2 of these, and they're both the 28 French, which is going to be your common size for most adults and most older children as well. Infants or smaller pediatric patients might need to go down a size, so if you are mainly dealing with those, or if you have smaller kids, you might want to look into the shears, the pen light, the splint, and all that stuff to get to this as well. And then it was in a separate bag, so I would recommend taping the lubricant to here and putting it in a more accessible position. Now, in here No, there's nothing in there. Here we have a ever ready trauma bandage. It is really just a large thing of gauze in here that you can use to just hold on a wound, wrap a wound, or you can set it on the wound and then wrap it with something else, an occlusive or a wrap as well. Moving on to the other side here. Here, this is in frame here. Okay, so it has these two little things that plop up. We're just gonna, and they do come off with Velcro. We're just gonna take them off and put them over here. We'll come back to those in a second. So here we do have a high strength emergency pressure bandage. This is for a wound that you can't exactly use a tourniquet for, but it does need constant pressure because of that bleeding. Mainly used for head wounds, can be used for chest wounds, and if you don't have a tourniquet, you can use it as a tourniquet or just to wrap a wound that is on a extremity. Here we have kind of like a boo-boo kit, I guess you could say. We have a very, very large roll of cloth tape here. And then in here we have a bunch of Ever Ready and We Care bandages. You have the basic size, your everyday bandage. You have a slightly higher size. You can see these are sort of like the knuckle or small knee injury bandages. And then you have the even bigger ones for knee and elbow injuries. A common misconception is that these are just sizes of bandages. They do have purposes. They have fingertip bandages for cuts on your fingertip, knuckle bandages, bandages for in between, like as you can see here, I have a cut in between here, and that's why I have this. They do have specialized bandages for cuts in that area. And that's what those different sizes are. And then obviously you have your knee bandages and different things like that. In here we have sort of like a ace wrap, cling wrap. It says on here sulfate here at bandage, which is what I have on my hand here. It's not meant to be used as a gauze. It's meant to wrap a wound that has already had gauze applied to it. And it is self-adhering, so you don't have to worry about taping it. You can tape if you want to, just to make sure it doesn't come undone. And then you have a small, this is a 1 inch wide roll, and then a 3 inch wide roll here. Those are also used for securing splints. So you put a splint on and then you wrap the foot, or if you have it on the foot, you wrap the foot to the splint, or the splint to the foot. And then you have here two Ever Ready rescue blankets. They are Mylar rescue blankets. So they are this foil looking material. They are used to combat hypothermia. So when somebody is really cold, their body will start to shut down. So this is just to reflect their body heat back onto them to warm them up. Very small, very lightweight, and a good thing to have in the winter seasons. Or if you live in an area where it's always cold, then very good thing to have. I would recommend not having, if you know that you're going to be in an area where it is going to be cold, I would recommend not using this as your primary source for heat. I would recommend having a larger blanket or like hand warmers or stuff that you can use. This is kind of just to put over it to reflect that heat, any heat that does escape back onto the patient. And here, as I was talking about, the NRA responder, compressed gauze, some of them say S-rolled gauze. Obviously this one isn't the S-rolled gauze, this is just compressed gauze. But it is a 4 by 5 inch by 4.1 yard stretch 6-ply cotton gauze. This is used for wound packing. It can also be used for wrapping a wound as well. The difference between S-rolled gauze is that S-rolled gauze usually has a red thing here, like these tabs, that you can push in, grab it, and you can pack the wound quickly. This one you do have to cut it, take all of this out, and pack the wound, or you can use it to wrap the wound as well. In here we have a great piece of medical technology. We have the triangular bandage. I don't know if it's a little bent there, but there you go. The two triangular bandages. Triangular bandages are great thing to have. Main usage is for a sling for a fractured arm. However, they can be used for a number of things, including a bandana, gauze, wrapping a wound. Seen people use them as a bag to carry stuff. So very versatile, very good thing to have in not only a first aid kit, but a survival kit as well. And they do come with clothespin or safety pins on the back to clip the triangular bandage if you are using it as a sling for an arm. Then we have over here two elastic bandages with little clips. These are also mainly used for securing splints, and these are not meant to be used as gauze. These are just to wrap over a already wrapped wound. Like, let's say you've packed a wound, you put gauze around it, and you just want to put this as an extra layer on top. You can just wrap it around it and use these clips to secure it. Now we're going to go on to, that is all that's in the kit itself. Now we're going to go on to the smaller little wings that are attached to it. So this one's sort of like your miscellaneous basic minor wound care items or topical items. You have a rescue whistle, very good thing to have in a first aid kit and or survival kit. You have, it looks like there is 1, 2, 3, 5 packets of burn gel here. You can use these, like if you touch the stove, get burnt, put this on it and wrap the wound. However, these are not supposed to be used for large-scale burns. So if you have a large portion of your body burned, I would not recommend using this. If you have second, third degree, even some first degree burns, I would not recommend using these. These are just for very, very minor burns. Moving on, we have hydrocortisone cream, which is used for cuts and scrapes, sort of like a lotion type thing, and it works sort of like a triple antibiotic cream as well. We have a medication packet here. Have 2 things of non-aspirin, 2 things of ibuprofen, and 2 things of antacid. So, for those of you who don't know, antacid, sort of like a meant to be for indigestion. Ibuprofen, obviously, is a painkiller. In a trauma scenario, I would not recommend using this. It's okay if you do, I just wouldn't recommend it because it does cause a thinning of the blood, and in a scenario where you're trying to stop the blood, it doesn't really make sense to use them. As well as non-aspirin, it does reduce that pain, but it does thin the blood as well. I'm not sure about non-aspirin, but a good thing to have is aspirin itself, which if you pop them in and chew them, you can, when you have pre-onset chest pain, it is a good thing to do to chew up 2 or 3 packets of aspirin, because it does loosen those platelets a little bit, help reduce or take away, break down any clotting that may be happening, and reduce the risks of a heart attack in the event that you do have chest pain. I believe that these are, yes, all just triple antibiotic ointment used for cuts, scrapes, bug bites. Most people know this as Neosporin. It's just the brand. Triple antibiotic is the actual cream itself. So good thing to have for minor lacerations, minor cuts and scrapes, as well as bug bites, rashes, different stuff like that. In here, I'm actually not sure what these are. Oh, I see, okay. So, these are kind of like bleed stop packets, but the Celex brand, hemostatic granules, so that it's a little powder that has a hemostatic agent in it, and you can put it onto a wound, and it's supposed to stop bleeding. I have not used it. I do know people in my family and different YouTubers and stuff who have used it and swear by hemostatic granules. I just haven't got the chance to use them, so I'm not sure how well they work. But definitely a good thing to have if you can't get to a bandage very quickly. It's a good thing to maybe like keep in your kitchen. You cut yourself with a knife, just put it on there. It'll stop the bleed, and then you get to a sink, rinse it off, and put some band-aids on. We got some alcohol prep pads. We got some sting relief wipes. Iodine prep pads. And we have, what is this? Just antiseptic, BZK antiseptic towelettes. And then a thing of smaller gauze pads, so it looks like we have 2x2 gauze pads and oral eye pads, 2 oral eye pads, sorry, oval, not oral, oval eye pads. Then we have 3M Steri-Strips. These, in my opinion, are a good thing to have. Sorry, part of this. Good thing to have. They are not a replacement for stitches, but they are a, wouldn't say a substitute either. They are just a good thing to have in general. They are sort of like stitches, but they stick to one side of the skin, you pull the wound closed and stick onto another skin. Definitely a thing to definitely something to have in like a wilderness kit. If you have a large laceration, you can use that as a substitute for stitches until you can get to a higher level of care. If you do use Steri-Strips, I would recommend as soon as possible getting stitches, because Steri-Strips don't last forever, and if you use them as stitches, they can also cause some scarring and different things as well. So if you have a laceration in which you use steri strips, definitely go get stitches as soon as possible. And then they just have the classic blue tweezers here that most kits come with. Just gonna pack this up here. There's a lot in this little packet here. Back in there. Alright, I'm just going to leave that down there then. The next little pack like this is the and yes, you might see me just shoving this back in here and throwing some of the stuff on the ground. I am going to reorganize this kit, so I'm not too worried about everything going back in the right spot. So next one is sort of like a miscellaneous and gauze little pack here. So we have 1, 2, looks like we have 2 2-inch gauze. We have 2 3-inch gauze rolls, and then we have 2 4-inch gauze rolls. So these are comforting stretch gauze. These are something that you can use to wrap a wound. I would recommend putting a non-adhesive pad there first and then wrapping it with this, just because this does have the tendency to stick to the blood and very hard to get off of a wound for anyone to get to the wound itself. And then they have very graciously given us a lot of gloves. So we have 1, 2, 3, 4, 5, 6 pairs of gloves. So up to 6 people can assist you using this kit, or if you break a pair of gloves, they do tear sometimes, so if they tear, I would recommend with any gloves, as well as just really any gloves, taking them out of the little bag, keep storing them out of the bag just so they're easier to get to, as well as putting them on a few times, or putting them on at least once, taking them off, and then putting them back in your kit just so that they are already stretched out and ready to go. Some people will blow into them. I don't like to do that just because I don't want the germs everywhere. So what I do is I will put them on occasionally, stretch them out, kind of go like this, take them back off, like this, and sort of just, it's not the prettiest, but it'll do. I just kind of shove the fingers in and roll it up, and then you can store it wherever you need to. Now I do want to say that I am not sponsored by the company. This was paid for by my own, or with my own money, and I am not getting paid or inclined to say anything positive or negative about the kit. Everything that I just went through, everything that I said during the unboxing of the kit was all my own opinion. not scripted, and was not paid to say any of those things. And now for my thoughts on the kit. I definitely think it could be organized a little better. Definitely having that major life-saving equipment easily accessible would be one thing to do, as well as organizing it a little bit more. Like, they had gauze in the front, they had gauze in the back, then they had a package of gauze. Maybe putting all the gauze in one spot, all the bleed in one spot, all the creams and stuff in one spot. Just having stuff a little bit more organized. Overall, I think it's a great kit. I definitely like the fact that they left some of those loops and areas open for you to put whatever you need in there. One thing I would recommend doing if you do get this kit is customizing it to the way you like it. Some people leave it basic as is, and you can do that, but just go through the kit and make sure you know where everything is, so that if you do have to use it, you're not scrambling to figure out where it is. Another thing I like to do is label certain areas. As you saw that there were 6 pairs of gloves, so if somebody else is helping you, I like to label stuff so that they know where everything is in the kit and they're not scrambling trying to find everything. So that is my thoughts on the kit, and thank you for watching.
One 32.